Hey guys, and welcome back to my channel, or welcome if you are new. My name is Hannah, and today's video is going to be all about my POTS. And if you don't know what POTS is, it stands for Postural Orthostatic Tachycardia Syndrome, and basically it means that your autonomic nervous system has been damaged or doesn't function right. It's also known as Dysautonomia, you might have heard that. But today I am going to share my story and my experience with POTS, and yeah, I've said I'm gonna film this video a million times and I've never really gotten around to it, but I finally am, and I'm going to be looking down a lot because I have notes on my computer and a notebook, and then at the end I am going to do a little Q&A because a couple of people have asked me some questions. So yeah, anyways, I'm going to stop rambling and just get into the video. So like I said, POTS basically means that your autonomic nervous system doesn't function right, and normally that happens after an infection or a concussion or anything that can injure your autonomic nervous system, if that makes sense. So about 8 years ago, in 2010, when I was 12 years old, I came down with a mono infection, and at the time I just had like your average mono symptoms. I had a fever, sore throat, stuffy nose, just things like that, and I had diarrhea. And sorry if this is going to be TMI, but this is just how my symptoms are and how my POTS is. So after about 2 or 3 weeks, I still wasn't getting better. I didn't have like the fever or the sore throat or anything anymore, but I still had diarrhea, and the doctor didn't really know why or what to do. I had just seen my normal pediatrician, and she eventually sent me to a GI doctor, and that was probably about 2 months after I had come down with mono. So like I said, my main symptom was diarrhea, and at the time that was the only symptom we really paid attention to, I guess. There were a lot of other symptoms, but they weren't really as prominent. So I went to the GI doctor, and they did like a colonoscopy, an upper endoscopy, a million other tests like CT scans, MRIs, and everything came back normal. And honestly, everything has come back normal for the past 8 years, but I'm going to get into all of my symptoms right now. Like I said, diarrhea is my main symptom. I will have that anywhere from 5 to 15 times a day on average. Now, I do have a C. diff infection now, but I didn't always have a C. diff infection, and I will get into my other medical conditions kind of at the end of this video. So besides diarrhea, I have vomiting, nausea, I'm very lightheaded all the time, dizziness, fainting. I do actually faint. Not everybody with POTS actually faints, but I do. Low blood pressure, high heart rate, blue hands and blue feet, blurred vision, joint pain, especially in my legs and hips and knees and ankles, like lower extremities, temperature intolerance, decreased sweating, dilated pupils, shakiness, and migraines. That is a lot, and that kind of just has to go along with my POTS. I do have other health issues, like I said, so these are just kind of the symptoms that are related to my POTS. So now I'm going to go over what I have been misdiagnosed with, and honestly, I feel like everybody has gone through this, where you have been diagnosed with everything under the sun and you don't really have any of it. So the first thing I have been misdiagnosed with was Crohn's disease. Originally, we thought I had Crohn's disease, and I was being treated for it 8 years ago when I first saw a GI doctor. Then after none of those treatments were working, they just said it was IBS, or irritable bowel syndrome, which they still say I have, but we're not really sure if I do or if it's the POTS that cause my symptoms. Then I was diagnosed with cystic fibrosis, which was very, very scary, and I was diagnosed with that because I did a stool study, and it had shown that I was not absorbing fat. So they tested like my pancreas, and something came back abnormal, and they decided to do a sweat test, and I failed that sweat test, and they diagnosed me with cystic fibrosis. Now we know when you have POTS, you can have decreased sweating, and that is why I failed the sweat test. So I don't have cystic fibrosis. I never had any symptoms of it at all, just the diarrhea, but that's not enough to say that you have cystic fibrosis. It's a lung disease. So okay, and then getting into more of like, they've diagnosed me with anxiety, depression, Munchausen's, which means that you are purposely doing this to yourself, or like making things up, purposely making yourself sick, if that makes sense. Laxative abuse. I had a doctor go call my mom and say that I need to be admitted to a psychiatric hospital because I am just abusing laxatives and there's nothing else wrong with me. At this point, I had already been diagnosed with POTS, so yeah, I can get more into that in a different video, but this video is probably going to be really long anyways, and yeah. I've also been diagnosed with anorexia. That kind of goes along with the laxative abuse. Just, yeah, it's frustrating because you know something is wrong, but no doctors believe you or anything, and it just gets really depressing. And I'm not gonna lie, I do suffer from anxiety and depression, but that's not my only problem. That's not causing everything else. It's kind of like I'm depressed and anxious because of my chronic illnesses. So now I am going to go over the tests that I had before I was officially diagnosed with POTS. So I've had 10 colonoscopies and endoscopies. Most of those are from fecal transplants, but I've had quite a few. I've had the sweat test for cystic fibrosis. I've had so many CAT scans, MRIs, blood work, stool studies. I mean, just your basic tests, and everything always came back normal, except for the couple that I shared with you. So now I'm going to go over how I got diagnosed, and it was a long process, and I'm not going to lie, like, it was a really, really rough time in my life. That was the point where the doctor had told my mom that I was just abusing laxatives, which obviously is not the case, and my mom and I had been researching and researching and researching because no doctors would listen, nobody knew what was wrong with me, and finally my mom came across POTS, and it, like, I fit the criteria perfectly, but we kind of brought it up to the doctors and they were like, POTS isn't real, like, they kind of got all offended and didn't believe it or anything. So we just kind of kept that in the back of our minds, and finally we mentioned it to one of my GI doctors who I love. Unfortunately, he moved and isn't around me anymore, otherwise I'd still see him, but he totally was on board and researched it and found that the Cleveland Clinic, which fortunately I live close to, had a POTS center and that I should try to go there. So I got an appointment with Dr. Moodley, and he was a pediatric neurologist, and he did a tilt table test and I failed miserably. I don't remember, I don't have those results, so I can't really say like what or how, like what the criteria is to fail, but I know that it was pretty bad. Now, that was probably 2015 or early 2016, and then he didn't really want to do anything. He started me on Florinef, but that didn't really help me at all, and the side effects for me were worse than the benefits. I would have severe leg cramps and insomnia, and it would drop my potassium very low, so I had to stop that. But when I turned 18, he unfortunately couldn't see me anymore, so we had to find a new doctor, and like I said, the Cleveland Clinic does have a POTS center, so we transferred my care to a cardiologist who is at the clinic, and his name is Dr. Jager, and he's been awesome. He did a bunch more tests. I remember our first visit was actually probably a year ago, and I've had so many tests in this past year. So he ran, I have to look at my notes because he ran so many. So he ran another tilt, and this tilt table test was the extended version. And when I tell you it was like the most miserable 45 minutes of my life, I actually thought I was going to die. And he ran that first and determined what other tests I needed based on that. And he said that I had one of the worst tilt table tests he has personally seen, which was not good. So then he also ran a hemodynamic and blood volume test, which showed how your blood vessels work in your legs, like how if your blood pools in your legs and feet, which I have severe venous pooling, and the blood volume test shows how much blood is in your body, and I have a low blood volume. So there are different types of POTS, and like the venous pooling is like one type, the hypovolemia or low blood volume is another type, and I have both of those. We also did an echocardiogram, which showed that I have a hole in my heart, or a patent foramen ovale. I think I'm saying that right, but he doesn't think that's contributing to my symptoms. I went to another cardiologist who did a workup on that, and fortunately it's not big or anything, and it's perfectly safe. I do take aspirin to prevent blood clots, but that is the only thing that needs to be done for that. After the echo, he did a QSART test, which is a sweat test basically, very similar to the cystic fibrosis one I had, and that shows that I don't sweat that much. That was done a long time ago, so I'm not quite sure the results, but I know that I failed that one too. Then he did a phlebo test, which I vlogged about. I'll try to link it up in one of these corners, but basically you sat on like this bench, and it was very similar to blood pressure cuffs on your legs, and they tilted you back and then forward and kind of measured how your veins constrict, I guess. I passed that one, which is good. That, he explained, was looking for any genetic abnormalities with your veins and like blood pooling, and fortunately I don't have anything like that. And then after all of those tests came back, he started me on a beta blocker called metoprolol, and I took that for close to a year, and unfortunately I had to stop taking that one also because it would drop my blood pressure too low, and if I went to like the lower dose it wouldn't help. So we kind of decided that it's not worth sticking with, so I stopped that one. And he referred me to another POTS specialist. Like, I continue to see him, but he wanted me to see a neurologist so that he works with, and I see Dr. Wilson at the Cleveland Clinic, and he has been amazing, probably the best POTS doctor I've ever seen. And he decided to run a bunch more tests. The first one was a small fiber nerve biopsy, which I also vlogged, and I will link that up here or in the description box. And that was looking for small fiber neuropathy, and that came back negative, so I don't have small fiber neuropathy. And he also ran a bunch of immune blood work, and we found out that I do in fact have an immune deficiency, which is why I can't get rid of the C. diff. So currently I am in the process of getting IVIG approved by insurance. Hopefully that will be soon, but IVIG is supposed to be one of the best treatments for POTS out there, so we are very hopeful that it will help me. So that currently is where I'm at POTS wise. I am not very far into my journey. I've been sick for a while, but I haven't been diagnosed for very long, so it is hard to share like what's worked for me and what hasn't worked for me. I don't get saline therapy or anything like that. I know a lot of POTS patients do, but I don't. I'm not currently on any medication, like I said, so it is hard to share what has worked and what doesn't work. The only thing I really do for my POTS is I drink at least 3 liters of Gatorade a day, and I take a bunch of salt tablets, and I wear compression socks. And recently I have started exercising on a recumbent bike. I plan to go to physical therapy soon. The Cleveland Clinic, again, with their POTS program, has a dedicated POTS physical therapy program that I'm going to start, but I'm having surgery soon, so I don't know when I'm going to start that, if it's going to be before or after I have surgery. But yeah, that basically is my entire POTS story. If you have any questions, please feel free to leave them in the description box down below. I'm sure I'm missing out details, but I'm trying to condense this as much as I possibly can because I don't want to talk for like 40 minutes straight, because honestly I could. I mean, 8 years of dealing with this has been rough, and I could go on and on and on. But next I want to talk about my other chronic illnesses that kind of play into my POTS but kind of don't. Like, I have some symptoms that kind of overlap, if that makes sense. So of course I have the POTS, and I have suspected Ehlers-Danlos syndrome, but we've had a hard time getting anybody to believe me or diagnose me, so that's kind of just I mean, it's not that big of a deal. If they diagnose me, there isn't going to be a change in my treatment plan. But I also have gastroparesis, which has contributed to my GI symptoms, and I have a C. diff infection, which I've had for 3 years that I haven't been able to get rid of. I also have endometriosis, which is why I'm having surgery, and I have chronic pelvic pain due to that. And I have an immune deficiency, which is why I can't get rid of the C. diff. Sorry, it's very hard to explain, and they all are connected, but doctors don't know why, if that makes sense. So yeah, anyways, now I'm going to get into the Q&A portion. Okay, so I have one question from Instagram, and this is from Emily, and she said, how long have you had all of these chronic illnesses? And the POTS I've had for 8 years. I have been diagnosed for 2.5, and the hole in my heart I've had all my life. The Ehlers-Danlos I've probably had my entire life. The gastroparesis I've had for 8 years, and the C. diff I've had for 3, and the endo I've been diagnosed for 1.5 years, but I exhibited symptoms with my endo when I started my period, which was when I was 14, so. Alright, and now on to the questions from YouTube. Alice asked, what is your POTS the worst? Like during a long walk, do foods trigger more symptoms or purely actions? So definitely in the middle of the night and early morning, my POTS symptoms are very bad. I can't just get out of bed in the morning. It takes me a while, and going to school used to be horrible. I could never just get up and go to school. It took me forever to be able to feel well enough to go. And any sort of standing for long periods of time, sitting for long periods of time, running, any sort of like activity where I exert myself would make my symptoms very, very bad. I remember I was in cheerleading, and when we would have to run, I would get so sick, and I didn't know why. I just thought I was out of shape, but now that I look back, I definitely know it's the POTS. And yeah, as a food, I don't notice that any specific foods trigger my actual POTS symptoms. I do notice foods trigger my other like GI symptoms. Like I can't have spicy or fatty foods. I have some severe food allergies that I have to avoid, but as for the POTS, no foods make my actual POTS symptoms worse. Caitlin asked a couple questions. So the first one is, how old are you? I am 19 years old. How long has this all been going on? Probably my entire life, but I first noticed bad symptoms 8 years ago when I had mono. Did it all come on suddenly, or have you always been sickly as a child? I had always been, I guess you could say, more sick growing up. I would always come down with, you know, more colds or stomach bugs or whatever, more than any other normal kid, I guess. But everything went downhill when I got mono 8 years ago. So I guess when I got mono. Shauna asked, what are the main symptoms you experience during a POTS flare-up? And my main symptom is dizziness and lightheadedness and like fainting, but I also have very low blood pressures and high heart rate, joint pain, migraines, a lot. I don't really consider my GI symptoms to be part of a POTS flare-up because of the gastroparesis and C. diff, but I guess diarrhea too. I'm not really 100% sure. Like I said, it's very complicated with all of my other medical issues, but yeah, I hope that answers your question. And lastly, Amy asked, can you explain exactly what this is and what is the treatment? So that's her first question, and I kind of explained earlier, POTS basically means, it stands for Postural Orthostatic Tachycardia syndrome. It's also called Dysautonomia, and your autonomic nervous system has been attacked and doesn't work right. So like the Postural Orthostatic Tachycardia syndrome basically means like when you go from like laying to standing, your heart rate will increase, which means tachycardia, and your blood pressure will drop. So like positional changes basically trigger it, but that's not all that triggers it, which is why most people use the term dysautonomia instead of POTS, but I call it both. I kind of hope that answers your question. I don't think I'm fully explaining it, but I'm doing the best I can. And then her last question is, are you in college or does the POTS prevent you from going to school? And currently I am not in college. POTS definitely prevents me from going to school, but I am going to start college this summer, and I'm going to do online classes through my local community college. I really want to go to like away, but it's just not gonna happen right now. I'm not healthy enough, but it is what it is. And my camera just stopped recording. It is what it is, and I can't change it. Honestly, I'm just happy that I'm able to do some online classes from home and get the basics out of the way. But yeah, so that is it for my all about my POTS video. I'm sorry if this was all over the place. It's kind of hard to condense this all down. Like I said, when it's been going on for this long, it's very hard to put everything together and explain it, but I hope you guys enjoyed it, and if you have any other questions, please feel free to leave them down below. And thank you so much for watching, and I'll see you guys next time.